Welcome to Module 4.4, where we'll explore ethnographic research, a qualitative tradition focused on understanding cultures and social groups. Ethnography offers valuable approaches for examining healthcare settings, professional cultures, and patient communities. In this module, we'll examine the foundational concepts of ethnography, explore its various types, and outline the process of conducting ethnographic research in healthcare contexts. Ethnography is a systematic study of cultures and social groups, focusing on patterns of behavior, beliefs, and experiences shared among members. It originated in anthropology as researchers sought to understand diverse human societies and cultures. A defining feature is immersion in the cultural context. Researchers spend extended time in the setting they study, participating in and observing everyday life. Ethnography aims for holistic cultural interpretation that connects observed behaviors to broader cultural systems and meanings. Anthropologist Clifford Geertz described ethnography as producing thick description, detailed accounts that capture not just behaviors, but their meanings within cultural contexts. This approach is particularly valuable for understanding healthcare organizations, professional socialization, patient communities, and how cultural factors shape health behaviors and experiences. Some types of ethnography offer different approaches to studying cultures and social groups. Classical or realist ethnography aims to provide objective accounts of cultures through extended fieldwork and detailed description. Critical ethnography examines how power and social inequities shape cultural experiences, with an explicit goal of exposing and addressing injustice. Autoethnography turns the ethnographic gaze inward as researchers analyze their own experiences within cultural contexts. Focused ethnography, increasingly common in healthcare, examines specific aspects of cultures or experiences through shorter but more intensive fieldwork. Virtual ethnography studies online communities and digital interactions, particularly relevant for understanding health information seeking and online support networks. Each approach offers different emphases and methodological tools for exploring cultural dimensions of health and healthcare. Conducting ethnographic research involves several key methods and processes. Participant observation, simultaneously participating in and observing social life, forms the cornerstone of ethnographic data collection. Researchers engage in fieldwork, spending time in the setting and creating detailed field notes that capture observations, conversations, and reflections. Key informant interviews with knowledgeable members of the culture provide insider perspectives and explanations. Examination of material culture, physical objects, documents, spaces, and artifacts reveals cultural values and practices. Analysis involves cultural interpretation that identifies patterns, makes connections between observations, and explains behaviors in terms of cultural meanings. This multifaceted approach allows researchers to understand healthcare settings as cultural systems, revealing how shared beliefs, norms, and practices shape both clinical care and patient experiences.